Good morning. We're about to begin. Indicate if you can hear me. All right. So for today's session, we won't be covering any PowerPoints. The focus is going to be on skills and drug calculation. But we're starting off by watching a couple of videos. All right. So let's start off with this one. Share.
Little on information received or dispatch centers that a gentleman has slashed his own throat. Responding to that call, there were all sorts of expectations going through our minds. You understand? Because we didn't know what to expect. But the habit that when we reached there, we saw him there on the bed, with his throat slashed. Wasn't a pretty sight, but knowing it's our job, we have to advance to the situation, and life depends on what we do at the present moment. We step forward and we realize that he was still breathing. So there was this ray of hope. We realized then, and moving the things around the surrounding to get to have proper control over the situation. We realized that the machete that he used was still there on the bed. During the process, we were still thinking, wondering if he's going to make it or not. But we continued to stabilize, packaging him in the ambulance, continue on our way now to the hospital, monitoring him as we went along, and handing him over to the local hospital. Based on my knowledge, I get to understand that he was safe.
The most important part of my job is that to know that I can help someone, and at the same time, persons look up to me because of what I do.
Most important about job is when sometimes you're trying to do your best, and you can't do it much to change the situation.
On the go, 24 hours a day, 7 days a week. The work of an emergency medical technician, EMT, is never done. When summoned, the goal of the EMT is to provide emergency medical services, EMS. That is, retrieve, care for, and deliver victims to an appropriate medical facility in the shortest possible time and under the best possible conditions.
Are you able to see and hear the video?
Yes, sir. Loud and clear.
All right.
Emergency medical services is a functional arm of the Jamaica Fire Brigade. It's an operation in 1996, and we started with 3 stations, Sunderland, Negril, and Ironshore. In August of the same year, Lucy came on board, so we had 4 stations in operation. Further on, in 2005, you had Linstead opening. Linstead is in St. Catherine. And then in 2008, you had Falmouth. So presently, we have 6 operational sites. EMS is staffed by emergency medical technicians who respond to a number of trauma and medical-related incidents, including road traffic accidents, cardiovascular emergencies, acute respiratory diseases, life-threatening trauma, severe bleeding, and obstetric emergencies. On a good day, we normally get up to 9 calls. Sometimes we do not get much calls, but what we do have is a lot of persons coming to the station requesting help. So, for instance, if the unit is out, then they still come here, and if we don't have a unit present, if for some reason the unit is down, they still do come here, and although the health center is nearby, they use this facility as a first resort. Let's say there is an emergency. The call comes in to the central post at the watchroom, and the firefighter in charge takes the information and alerts his colleagues at the station if it is that the team is in-house with the emergency bell. Once that bell is rung, EMTs have to respond within a minute of the call. EMTs are firefighters who have indicated a need for EMS training. They are trained at 3 different levels: basic, intermediary, and advanced. At the basic level, training is 320 hours, inclusive of 3 weeks in the hospital. When you finish that, you start working, then you can always move up to the next level, which is intermediate. Now, intermediate is 480 hours of training. I have to do a month in the hospital. If you want to do additional training to the paramedic level, then you have to go overseas, and that is a total over 1,000 hours of training. EMTs are brave men and women who are dedicated and equipped to providing the health care you need, oftentimes right where you are. For more information on EMS or any other specialized area in the Jamaica Fire Brigade, visit their website www.jfb.gov.jm or call 922-2523 or 922-0007.
All right. So that was video 1. Any questions before I go to the next video?
No, sir.
All right. The next video will be on lung sounds. Where is that video? Physiology of breathing. All right, so let me share this one. Share physiology. So this is a video on breath sounds. Pay attention to what is normal and what is abnormal. So that's breath sounds. Any question before I go on to the next video? Go ahead.
So now I find it hard to kind of differentiate some of them. So far only two I can definitely tell the difference on a stride and the Crackles.
You won't be able to differentiate breath sounds by watching the video one time. You'll be able to differentiate breath sounds by listening to patients' lungs, right? So when you're in the field and you get accustomed to what is normal, anytime something is wrong, you'll be able to pick it up. The video is just there to give you a idea of what the normal sound would be like and what abnormal sounds would be like. So it's not there for you to learn how to differentiate. That's something you will develop through experience. Yes, Cameron, go ahead.
Morning, sir.
Yeah.
Johnson here.
Yes, morning.
All right. Just want to say something to Wilson.
Yes.
But other people can hear. Well, that's why you end up use the sticks, because the naked ears alone can pick up certain frequencies. So you want something better, right? So Wilson, that's why you now go hear certain things from a video. Because your ears can process certain frequency by itself.
All right, that would be reasonable. So that would be reasonable, right? That's why the purpose of this, you use the stats, because if you can recall on the video, there was wheezing, monophonic wheezing, and polyphonic wheezing. Everybody know the difference? What was that?
Yeah, mono have to deal with one. So I hear the things from one side,
Yes.
while poly are two. So
Yeah.
both sides.
Poly is actually more than. So it wouldn't be specifically two. Poly would be multiple areas. But yes, monophonic is specific to one area. So that would be correct. All right, now the next video is actually a skill that you will be evaluated on. It's oxygen administration. So you must know to assemble a tank and provide supplemental O2 via a high flow device and then switch over to a low flow device. So let's watch this video. All right, let's share. Here we go, share. So you always, once you're being evaluated, always start your skill station by taking standard precautions. If you fail to do that, you will fail the skill station because standard precaution is a critical area. So that's standard for every scale. Now, if it's a brand new cylinder, the cylinder will have a seal right here. So there will be something that seals the port. You have to remove that seal. So you remove the seal, and then you take out there's also another seal inside of the port. So there's a covering, you remove that covering, then you remove the seal. Ensure that the port, the oxygen port, is not pointing to anyone. So it shouldn't be pointing towards you, it shouldn't be pointing towards the patient. The next step is to take the cylinder key and crack. We call it cracking the cylinder. So what you're doing is cracking the cylinder to blow out any dust that was in the port. Then you take your regulator, put it on the cylinder stem, ensure that the pins line up correctly. Then you secure the regulator to the cylinder. When you're going to open it all the way, ensure that your flow is not turned on. So ensure that the regulator flow is not turned on, as you're going to waste the oxygen. Now, if the patient is not tolerating the mask, do not turn off the oxygen with the mask on the patient's face. So for the nasal cannula, you would secure it around the ears and then tighten it under the chin. You won't be able to do it on that mannequin. When you're going to discontinue again, do not turn off the devices with the oxygen. Sorry, don't turn off the oxygen with the device still on the patient. Remove the device first, then turn off the oxygen. Now, after you remove the device and turn off the oxygen and disconnect, the next step is to turn off your cylinder. After you turn off the cylinder, you need to bleed the residual oxygen out of the regulator. So you're going to open the regulator to release whatever residual oxygen remains. Then turn off, so once the residual air is out, turn off the flow, and you can disconnect at that point. That would be the end of the skill station, and that's a 5-minute skill station. Yes.
Yes, answer.
Yes.
So the purpose build out the residual air out of the regulator.
Yes.
Because the air inside it have still have some kind of pressure from the regulator in terms of pull it out.
Not necessarily. Yes, there would be pressure if you try to disconnect. But let's say you're keeping the regulator on the cylinder. If you're keeping the regulator on the cylinder and air is still trapped, you're going to end up giving your patient still oxygen.
Okay.
So that's not clean anymore. You're going to
Okay.
introduce microorganisms into the patient lungs.
Okay.
Once you use your oxygen cylinder and administer oxygen, if you're going to keep the regulator on the cylinder, make sure you bleed the air out once you turn the cylinder off, as you're not going to be giving the patient clean oxygen. You get that?
Okay. Point taken, because I just sometimes this is something that I have to ask. A clean understanding so that people can be aware, right?
Yeah. But you are correct. If there's pressure still inside of the regulator, it's going to be trapped. I don't think it would create a pressure on the valve stem unless you open it.
Okay,
Yeah.
sir. Okay.
All right. So any other question with the supplemental skill station? It's a 5-minute skill station. You'll be given a patient presentation. You decide if you're going with high or low flow. You'll be told that the patient can tolerate, or you will be told that the patient is not improving if you start off with a nasal canal. And you switch up. Fairly straightforward skill station. All right. Which video would be next? So that's oxygen administration. I don't think any more videos is required at this point. Let me see. Yeah, no more videos right now. Oh, there's one. No, I don't need to show that video yet. All right, so let's go to this section now. Let's go to drug calculation. All right, so there are a couple medications that you may have to pull up to administer, right? Now, because of that, there's basic drug calculation formulas that you need to be familiar with. So we're going to be doing some maths now. You need to pay attention, make sure you have something for write. If you can't work it out in your head, use the calculator on the phone. And if you turn the phone to the side, you'll get scientific calculator if you're not already aware of that, right? So long way is just an ordinary calculator if you have a smartphone. If you turn it to the side, you'll get a scientific calculator. All right, so let's look at drug formulas. No, the first one, everybody can see the handout clearly?
Yeah, yes, yes.
All right, good. So the first formula that you have to be familiar with is exact concentration, right? How to work out exact concentration. Now, exact concentration is the amount of a drug that is available in 1 ml. So let me scroll down to the fourth page. So let's look at this page. Right now, majority of the medications that is given in EMS is going to be in a solution, right? So emergency medication is administered as solution. Now that particular solution has a weight, a certain weight of the medication in a certain amount of fluid. That is what we call concentration. So a certain amount of the drug is in a certain amount of fluid. The exact concentration is how much of that drug is available in 1 ml. Everybody follow me so far? If you're lost, indicate. This is something you will be evaluated on. Where did I lose you, Mr. Man?
Yes, sir. If you could just say that again, sir. I heard it, but I just didn't quite understand.
Okay. Do you understand what is a solution? That's the first thing I need to ask you. You know the difference between a solution and a suspension?
Well, now that you mentioned suspension, no, but in regards to the solution, I was looking at the picture. I was assuming it'd be like a higher concentrated amount of substance.
No, not necessarily. So a suspension is a fluid. So it's a fluid containing medication, but the medication does not completely mix together. So like Maalox, Pepto-Bismol, a metadose inhaler, you have to shake it up before you drink it, right? So when you have to drink Pepto, you have to shake it up, because once you put the suspension down, the medication goes down to the bottom of the bottle, because it doesn't completely mix together. So when you're going to use it, you have to shake it up and then you use it. That's a suspension. A solution is fluid that contains drug, right? So we need to get the drug inside of the patient, and one of the best ways to do that is through the IV route or intramuscular. As EMT, you will be required to give intramuscular medication depending on protocol. So for that medication to pass into the bloodstream, it has to be in a solution. So it needs to be in some fluid, right? Now, the solution contains a certain amount of drug and a certain amount of fluid, and it completely mixed together. So you cannot separate the two, right? You can't separate the medication from the fluid if it's a solution. You can separate the medication from the fluid if it's a suspension. That's the difference. You understand now?
Yes, sir. That makes a lot of sense. So it in the solution there's no settling like the
Right.
suspension.
Good,
Okay.
because completely mixed together, right?
Okay.
Now, what I'm saying is that any medication that is given in solution form will have a certain amount of drug in a certain amount of fluid. The exact concentration is the amount of drug that is available in 1 ml. So that's what we call exact concentration. The amount of drug that's available in 1 ml. So look at example 1. So the formula for exact concentration. So this is what you need to remember, the formulas. Just apply the formula. The formula for exact concentration is the amount of drug divided by the available volume. The drug is the milligram, the volume is the mil. Example 1 is 8 milligrams in 4 mil. So you have a 8 milligram solution, you have a solution containing 8 milligrams in 4 mils, and you want to know how much of that medication is available in 1 mil. Based on the formula, you're going to divide 8 milligrams by 4 mils, and you get 2 milligrams per mil. So that's example 1. Pretty straightforward. So you're dividing the top value by the bottom value, right? Or you're dividing the milligrams by mils. Example 2, you have a solution that contains 20 milligrams in 5 mils. What is the exact concentration? Based on the formula, it is the amount of drug divided by the available volume or mils. So that would be 20 milligrams. Sorry, that would be 20 milligrams divided by 5 mils. So that's 4 milligrams per mil. Now the other two, so the classwork, first one. So this is for you to do now. Type your answer. 5, you have a solution with 5 milligrams in 5 mils. What is the exact concentration? Work that out. Type the answer. I see one person waiting on the others. That don't write out properly. So just as how you see it write out on the handout, that's how you're gonna write it. All right. So if that good. So that is pretty straightforward. It's 1 milligram per mil. Next one. You have a solution that contains 250 milligrams in 50 mils. What is the exact concentration? Type the answer. All right. So that would be 5 milligrams per mil. So that would be correct. Now, this is where it gets a little tricky. So you need to pay attention now. You can have a percentage solution. You can have a percentage solution. So listen carefully. When it's a percentage solution. So percentage solution, exact concentration is the number of the percentage. Sorry, the number of the percentage represents the amount of gram in 100 mil. Because it's a percentage solution, your volume will always be 100 mils. Whatever the value of the percentage is, it represents how many grams are present in that solution. What does that mean? If you have a 1% solution, it's 1 gram in 100 mil. If you have a 2% solution, it is 2 gram in 100 mils. If you have a 20% solution, it is 20 grams in 100 mils. That's what it means. Example 1, you have a 5% solution. So that is the same as 5 grams in 100 mils based on the principle or formula of exact concentration, the amount of drug divided by the available volume. You're dividing by 100. So you have to move your decimal point to the left. And that would give you 0.05 grams per mil. It's 2 0, so it's 2 points to the left. For example 2, 10% solution, it's 10 grams in 100 mils. And that's going to give you 0.1 gram per mil. Example 3 now. Now, example 3 is a little bit more complicated. So you can have a percentage solution, but the dosage that you need to give is milligrams, right? So you need to give it in milligrams. So the first thing you need to do is you need to know what the percentage represents. So in example 3, it is 5%, a 5% solution, right? You want to find the exact concentration of a 5% solution in milligrams. So first of all, what does the 5% solution represent? It represents 5 grams, right, in 100 mils. We know that. Now, we need to convert that gram first because why? The answer or the drug that we need to give need to be given in milligrams. So you know that the 5% is 5 grams. You need to convert that to milligrams, right? It's from a large measurement, sorry, a large to small. So you need to multiply by 1,000. So 5 grams times 1,000 would give you 5,000 milligrams. So now that you have it in milligrams, you put it over your volume, which is 100 mil, and then you follow the formula. Divide the 5,000 milligram by 100, and that would give you 50 milligram per mil. That's the answer. So if it's a percentage solution, but you're required to give it in milligrams, you need to convert the grams first to milligrams, and you do that by multiplying by 1,000, then divide by 100. All right. So example 4, 10% solution in milligram. So that's 10 grams times 1,000. That gives us 10,000 milligrams. Divide that by 100 mils, you get 100 milligrams per mil. That's the answer. Classwork. What is the exact concentration of a 20% solution in gram and milligrams? I want 2 answers. Work that out. Type the gram first. Waiting. Why are we taking so long?
The second one, sir. Just a second.
I said I want the answer in gram first.
Okay.
Exact concentration in gram first. Do not type the answer. Miss Lewis, that's not correct. On to the rest. I've seen Powell. If there is no zero in front of the decimal point, that is incorrect. You can put 0.2 grams on a medication order. That can be interpreted as 2 grams. The zero must be in front of the point. All right. And someone who can't follow instructions. I said gram first. I haven't said anything about milligrams yet. All right, so let me see what's going on. So Johnson, that's not correct. Miss Wellington, that's not correct. Cameron, that's not correct. Okay, Miss Lewis made a correction. All right, so the first concentration is supposed to, Miss Cephas, that's incorrect. People seem like kind of confused at this point. So I'm going to put the correct answer, then I'm going to put in the incorrect answer. All right, so let me see. All right. So what is the concentration of a 20% solution in gram? 20% represents 20 grams in 100 mils. So to find out how many grams per mil, you simply divide 20 by 100. Right? You're gonna move 2 places with a decimal point. So you have to start behind the 0 and you move 1, 2. So the point is going to end up in front of the 2. So your answer should be 0.2 grams per mil. So that is your answer in grams per mil. Convert that to milligrams per mil. Type the answer. Take the S off the mils. So if you give me a drug sheet with S on it, take that S off the mils. So don't put S on the mils. That's not how you write it in your drug sheet or report. Cantaloupe, it's not 20 milligrams per mil. So you're doing something is off there. The answer is already, the initial answer is in grams per mil. All you have to do is multiply that by 1000. Multiply the gram by 1000. Okay. All right. All right. So I hope people are following. Anybody lost and they are bush yet? And I can understand what going on. I hope so. All right. It's going to get more complicated now. So pay attention. We have looked at straightforward concentration. We have looked at percentage concentration. Now you can have a concentration that is in a ratio, right? So like epinephrine, you're going to see it in a ratio. 1 in 10,000, 1 in 1,000. So you need to know what that means. So let's use this example. So if you have a medication that is in a ratio of 2 in 1,000 or 2 in 1,000 solution, this means that there is 2 milligrams in 1,000 microliter, which is the same as 2 milligram per mils. Right? Yes, Miss Lewis.
Sir, will it always be in micromil? As in the 1,000, 2 in 1,000? Will it always refer to micromil at all times?
Not micromil, microliter.
Sorry, yes,
Yes.
microliter.
Yes.
Okay.
All right. So 2 in 1,000 means 2 milligram in 1,000 microliter, which is the same as 2 milligrams per mil. And that is the exact concentration. So I don't need to go any further. The other example is you have a solution that is 2 in 10,000. And that means 2 milligrams in 10,000 microliter, which is the same as 2 milligrams in 10 mils. Right? The exact concentration of that would be 0.2 milligram per mil. Classwork. You have a solution that is 3 in 1,000 and 3 in 10,000. What is the exact concentration of the 3 in 1,000 solution? So that's the one you're doing first. 3 in 1,000. Type your answer. Waiting on the rest. Shouldn't be taking you too long, you know. Shouldn't be taking you too long at all. All right. So that's 3 milli. Fix up that, Johnson. Don't know what is 3M3. Fix that up. All right. Or you get 2 milligram, Miss Lewis. 2 capital MG. Fix that up.
Sir.
Fix that up. All right. So 3 in 1,000 is the same as 3 milligrams in 1,000 microliter, which is the same as 3 milligrams per mil. All right. Work out the 3 in 10,000 solution. Exact concentration. Type the answer. "30 milligrams is not correct, Mr. Chantilu. Fix that up. Make sure to know when I get the 0.3 milligram, you know. If you don't know how you're getting that, there will be consequences. you will have to demonstrate this to me in person. All right. All right, look like we're seeing some consistency. So 0.3 milligrams per mil would be correct for a 3 in 10,000 solution. So 3 in 10,000 solution is the same as 3 milligrams in 10,000 microliters, which is the same as 3 milligrams in 10 mils. Exact concentration, divide the 3 by 10. You should get 0.3 milligrams per mil. Good. Now we're moving on to our next formula. So I'm finished with exact concentration. That's the 3 things that you need to be familiar with. All right, so let's move on to the next formula. Now that we understand what is meant by exact concentration, what you need to know now is that a solution, a particular solution for a drug can have a certain amount of the drug in a certain amount of mils, and you are given an order to give a portion of that drug. So you're given an order to give a portion, not all of it. You need to be able to work out how much mils would represent the amount of drug that is required. We call this the volume of a drug to be given, right? So you need to know to work out the volume of a drug to be given. And the formula is the desired dose, right? The desired dose, that is a dose that you are supposed to give. That's the desired dose. Times the available volume. The available volume is how much mils the drug is in, right? So desired dose is a dose you are supposed to give. The available volume represent the amount of mil that you have available. So it's the desired dose times the available volume, that's the amount of mil available, divided by the amount of drug available. The amount of drug is how much of the drug is present in mils. So example 1, your standing order says give 2 milligrams of 8 milligram in 4 mil solution. That is the standing order. So you have a solution that contains 8 milligrams in 4 mils, but your standing order says give 2 milligrams. So you need to determine how much mils would represent 2 milligrams, because that is what you're going to drop in your syringe and administer to the patient. So the desired dose would be the 2 milligrams. So that's 2 milligrams times the available volume. So that's 2 milligrams times 4 mils divided by 8 milligrams. Now you have this milligram will cancel out this milligram. So this milligram I go cancel out this milligram. You're only left with mils. So your answer must be in mils. Then you simply divide you just work the equation at that point. I will tell you where you simply divide, because I know basic maths where I do. I expect you people to know to multiply, divide, add and subtract, right? So based on the formula, 2 milligram times 4 mils divided by 8 milligrams will give you 1 mil. So we're going to pull up 1 mil and administer, and that 1 mil would have 2 milligrams of the drug. So we have the exact dose that we need for the patient. Example 2. Your standing order states give 2 milligrams of a 10 milligram in 2 ml solution. 2 milligrams of a 10 milligram in 2 ml solution. The desired dose, so the volume of a drug to be given is the desired dose times the available volume. The desired dose would be 2 milligrams. The available volume would be 2 ml. So it's 2 milligram times 2 mils. Divide that by 10 milligram. That's the amount of drug you have available. Milligrams will cancel out milligrams. So your answer must be in mils. And that would give you 0.4 mils. So if I pull up 0.4 mils of this 2 mil solution, it would have 2 milligrams inside of it. And then I give it to the patient. Now let's see if you understand all of that. Classwork. You have 100 milligrams. Sorry, give 100 milligrams of a 250 milligram solution in 5 mils. Work that out. Type the answer. So you're giving 100 milligrams. Show working. Show working. So show me how you get to that point. You will have to do that in person. Go ahead, I'm waiting. Okay. To the rest. Come on, people. Show some. All right, so I've seen Cameron, Powell, Miss Wellington. What's going on with the others? We're not familiar with our devices that we're using. While I'm young, people, I don't want to age waiting. While I am young. But we're not do so long. Oh boy. Here we are. Okay. All right. All right. So that's the volume of a drug to be given. That need to fix up, Miss Lewis. The answer is correct, but I don't know where I'm going with that dash there between the 5 mils and the 250. You can't write it out like that. Excuse me. All right. I think most persons get the general idea. Yeah. So when you get your worksheet, if you cannot show the working, you won't get the mark. And when we're face to face, you will have to demonstrate. So ensure that when you get the worksheet, you are doing your own work. All right, let us move forward. Now, apart from volume of a drug to be given, so the volume of a drug to be given is the desired dose times the available volume divided by the amount of drug you have. That's the volume of a drug to be given. That's how you work that out. Now, you may be required to do volume infusion or volume of a fluid to be given. That's what I should say. Volume of a fluid to be given. Now, there's a difference between giving a bolus and there's a difference between giving a bolus and a titrated amount over a specified time. So bolus. So let's look at volume of a fluid to be given now. And this is specific to fluid resuscitation. So definitely not going to be teaching you how to give medication through a IV. But you will definitely need to know about fluid resuscitation, how to start an IV access and administer fluids without killing your patient or affecting the patient prognosis when they're recovering. So the volume of a fluid to be given is the volume to be given times the drip set divided by the time in minutes, right? Now, fluid be given as a bolus. Bolus mean you give it one time. That's what bolus mean. You give it one time. You have the 3-to-1 rule. So it can be, your protocol uses the 3-to-1 rule, which is pretty straightforward. What that means is for every 3 mil or every 3 liter, sorry, I said that wrong. For every mil or every liter, you will give 3 times that. Right? So if you suspect that your patient has lost 1 liter of blood, you will give 3 times that amount. If you suspect that the patient has lost 2 liters of blood, you will give 3 times that amount. Now, based on that simple rule for giving a bolus, if you suspect that the patient has lost 500 mils of blood, how much fluid would you give the patient based on the 3-to-1 rule? Type the answer.
Sir, could you repeat the amount? You broke up a little bit on my end.
Your connection that, the patient has lost 500 mils of blood. How much fluid would you give the patient? Are you going to give it in liters or mils? Which is it? You can titrate 1.5 liter. Who was that? Mr. Chantiloop. You can titrate 1.5 liter. Okay. So that would simply be 500 mils times 3. That's 1,500 mils. Right? So that is a 3-to-1 rule. Pretty straightforward. Now, your protocol can also say that you should give 20 or 30 milligrams per kilogram for adults, or 5 to 10 mils per kilogram for your pediatric patient. So this is weight-based now. You're giving the fluid based on weight. So if your protocol, so listen carefully, if your protocol says to you, give 20 mils per kilogram, so you're giving 20 mils per kilogram, your patient weighs 120 pounds. Well, don't work that out. Don't work that out. It's all right. Don't work that out yet because we need to go through the example. Let me not jump the gun. All right. So that's bolus, right? Bolus mean you work it out, you give it one time. Still need to be controlled administration. So even let's say the patient, when you worked it out at 500 mils, so the patient had 500 mils in terms of blood loss, right? When you work it out, you get, using the 3-to-1, you get 1,500 mils. You're giving it as a bolus, but it needs to be controlled administration. So what does that mean? It means that after every 500 mils, and if it's a geriatric, every 250 mils. So after every 500 mils, I am going to reassess the patient, right? So you give and you evaluate, where's the pulse, what the pulse feel like. What is the patient's level of consciousness? So after every 500 mils, I am reassessing the patient. And if it's a geriatric, after every 250, I'll be listening to lung sounds to make sure the patient is not developing pulmonary edema. All right, now your drip set. So the volume of a fluid to be given is the volume to be given times the drip set. Now the drip set, you can have a micro drip set or you can have a macro drip set. Your micro drip set can be 30 to 60 drops per mil, and your macro drip set can be 10, 15, or 20 drops per mil. Macro is for shock. So if you suspect shock, you use a macro drip. Micro is for infusion. So when you're going to give medication infusion, or you're probably just running fluid to keep the vein open, then micro drip would be acceptable. And we will start IV access for 3 reasons. But for you, it's only going to be 1. So it's 3 reasons in which IV access can be initiated. You can start an IV to prevent a vein from collapsing. You can start an IV to give a medication. And you can start an IV for fluid resuscitation in a shock patient. That's the only reason why I'm teaching you this. It's for fluid resuscitation and KVO, right? To keep a vein from collapsing because it's the same fluid you're running. So if it's a micro drip, it's for medication infusion or controlled administration. For macro, you're looking at 10, 15, 20, and that would be for your shock patient. Now, what does it mean? What does all of this mean? So if your drip set is saying to you 30 to 60 drops per mil, it means that it takes 60 drops to give you a mil, or it takes 30 drops to give you a mil. If you're using a 10 to 15, 10, 15, or 20 drop microdrip set, it means it takes 10 or 15 or 20 drops of fluid to give you 1 mil with that set. That's what it means. So macro is for shock and micro is for medication and control administration. All right. Now, before we go down to the example, using the mils per kilogram, you have a patient that weighs 140 pounds. No, we're not going to get confused. Make we go through the example. All right, so example 1, you have a patient that weighs 160 pounds. The patient requires fluid for resuscitation at 20 mils per kilogram using a 10 drop per mil set. The first 1,000 mils must be given as a bolus. The remaining fluid must be infused over 1 hour. So you're going to give 1,000 as a bolus, and then you're going to use the volume of a fluid, volume infusion formula, to work out how many fluid, what is going to be a drip rate per minute for the remaining portion of the fluid. Now, this is how we're going to work it. So the first thing is you need to convert the pounds into kilograms. That's the first thing. You can use the rule of 10, or you can divide by 2.2. It doesn't matter to me. So you're allowed to use a calculator. Just note that if you decide to do an advanced EMT course or a paramedic, you're gonna have to work this out in your head. Because when you're doing your pharmacology exam, you're not allowed to use a calculator. Now, so the first thing is we need to convert the pounds, to kilogram. Using the rule of 10, you divide 160 by 2, and that would give you 80. Then you find 10% of that 80, which is 8. So 10% of 80 is 8. Then you subtract that 8 from the 80, and that gives you 72. 72 is less than 75. So you round down to the nearest tenth. Less than 5, so you drop off that 2. Why am I doing that? Because it's easier to work with zeros when you have to titrate fluid in the field. Right? It's 72 point this or 1003. It's easier to work with zeros. So you either round up to the nearest tenth or you round down. And in this case, because 72 is less than 5, we round down. All right. So it's 70 kilograms. Now we have the patient weight in kilogram based on the formula of 2 mils per kilogram. You will simply multiply 70 kilograms times 20 mils per kilogram. Kilogram will cancel out kilogram, so you're only left with mils. Put 2 zeros. 2 times 2 is 14. So that's 1,400 mils. And you're supposed to give 1,000 as a bolus. So that's 1,100 minus 1,000 mils. So 400 mils remain. Then we need to give that over an hour based on the formula now. So based on the formula, 4 mils per hour using a 10 drop set, it is the volume to be given times the drip set divided by the time in minutes. The volume to be given is 400 mils. The drip set is 10 drops per mil, so that's times 10 drops per mil. The 1 hour, you convert that to 60 minutes. So it's 400 mils times 10 drops per mil divided by 60 minutes. That gives you 66.6 drops per minute, right? And you would round this off to 67. 67 drops per minute. Now, if you want to know how many drips per second, because you have to titrate it per second when you're adjusting your drip rate on your IV set, you simply divide 67 drops by 60, and that will give you drops per second. So that's the final example. Now, let's see if you understood all of that. Yes, Miss Cephas.
Sir, what did you say would give you drips per second?
If you have drips per minute divided by 60, it takes 60 seconds to give you a minute. Yes, Mr. Wilson.
Sir, a pressure gauge kind of if you know.
Well, that's a one, you know. That's a one. Where you lost?
Only for the formula, like just walk me back through the formula.
All right. So you understand what the question is asking. That's the first question. Yes?
Not exactly, sir. Not exactly.
All right. So you need to give a patient fluids, but you have the patient weight in pounds. So you have a 160-pound patient, and you need to give fluids based on your protocol. And your protocol says to give 20 mils per kilogram using a macro drip set, specifically 10 drops per mil, right? So, but the protocol also states, or the direction that you were given, it also states that when you work out how much fluid this patient must get, give 1,000 of that fluid as a bolus, meaning you're going to give it one time. You don't need to titrate that. You just put up your 1,000 mils, open it wide, make it run. After 500 mils, reevaluate your patient, then run the next 500 mils. That's 1,000. And then whatever remain, you will give it over 1 hour. So you're not going to give all of it at once. You're going to give the remaining portion over 1 hour. And when you have to give a certain amount of fluid over a specific time frame, you have to use what is called volume infusion formula. We call it the volume infusion formula, which states that you will give, it is the volume to be given times the type of drip set divided by how much time you're going to give the fluid in minutes. So we have to work out the first part. Patient weighs 160 pounds using the rule of 10. So as I say, if you want to convert the pounds to kilogram, you can use the rule of 10, or you can simply divide 160 by 2.2. Right? So using the rule of 10, you divide 160 by 2. That would give you 80. You find 10% of that 80, which is 8. You subtract that 8 from 80, and you get 72. 72 is less than 75. So we want to work with the nearest tenth. We're going to round down to 70, because when we're giving fluids in the field to titrate it easily, it's better to work with zeros. So you get 70 kilograms. Based on the formula now, which is 20 mils per kilogram, you will multiply 70 kilogram times 20 mils per kilogram. Kilogram will cancel out. Kilogram, you're only left with mils. So this patient that weighs 160 pounds at 70 kilograms, you would give him 1,400 mils. However, your standing order say give the first 1,000 mils as a bolus. So you're going to give the first 1,000 mils as a bolus. And then you will work out how much fluid, the remaining portion, you will give that over an hour, which is 400 mils. Now, based on the volume infusion formula, which is the volume to be administered times the drip set divided by the time in minutes. So it's 300 mils per hour. The desired 400 mils per hour using a macro drip set of 10 drops per mil. So that would be 400 mils. The 400 mils is the volume to be given times the macro drip set, which is 10 drops per mil, divided by the time, which is 1 hour in minutes, and 1 hour is 60 minutes, right? That should give you 66.6 drops, and this should round up to 67. So it would be 67 drops per minute. That would be the drip rate per minute. If I want to know what the drip rate is going to be per second, which you have to work it out per second, then you divide that 67 drop by 60, and it will work out to 1 drop per second. So you would adjust the drip rate using your watch to 1 drop per second, and that will give you 4 mils over an hour, and that would be the answer. All right, now let's see if it made sense. Yes.
Yes, sir. How you come up with the amount of fluid, so you know that the 1,000, and then you know that you have 400 milliliter remaining after the 1,000.
I don't understand what you're asking.
Right, so
I give fluid based. So you're going to give the fluid based on the standing order, and that's what the standing order is saying. So I don't understand what you're asking. Where you ask how you come up with the fluid. It's based on the standing order.
So the standing order says that the first 1,000 mil must be given as bolus. The remaining fluid must be infused over an hour.
Right. So if the patient total amount of fluid is 1,400 and your standing order say 1,000 mil as a bonus, you simply subtract 1,000 mil from the amount, and that will give you the remaining portion of the fluid that you will give over an hour. Right? So no EMT or advance or paramedic is going to come up with any fluid. Whatever fluid we come up with will be based on the standing order that we're following, whether it is 3:1, whether it is mils per kilogram, whether it is standard for the condition. We don't come up with the fluid. We'll work it out based on the standing order that we're given. Don't know if that answered the question, but.
All right, so you can work out how is it that the amount of fluid ended up being 1,400 mils.
But just work that out. It is there. See it right here, so you know. This is how we get 1,400 mils. We convert the patient's weight from pounds to kilogram and then multiply it by 20 mils per kilogram based on the standing order. You got that?
Yes, sir.
Right? So the weight is here. The weight was converted to kilogram. Based on the standing order, it's 20 mils per kilogram. So we have to multiply his weight by 20 mils per kilogram. That's how you would get 1,400 mils based on his body weight. All right. Anyway, we're going to take a little break. Let me see the time. Gonna take a 15 minutes break. 15 minutes, right? This is why I said we have to creep first before we walk. Now we start walk, now we start to jog. Make sure you can keep up. Make sure you can keep up, right? And this is one of the reasons why you're required to have maths to do the course. All right, so 15-minute break, and I'll give you a question to work out. Talk quickly, Mr. Money, before I...
Oh, sir, that's what I was gonna say. If you could skip to the question so we can just look at it while we're on the break.
No, certainly not.
Or a practice question or something, sir.
No, when I return.
All right.
I don't want you to have too much time to go work that out. All right.